reproductive health significant, and what methods are taken up to achieve it? When were the family planning programs initiated in India? What are the improved programs covering wider reproduction-related areas currently in operation in India called? Answer: C. Reproductive and Child Health Care (RCH) programs. What are the major tasks under the Reproductive and Child Health Care (RCH) programs in India? What role do parents, close relatives, teachers, and friends play in creating awareness about reproduction-related aspects? Why is the introduction of sex education in schools encouraged? What is the purpose of statutory bans on amniocentesis for sex determination? What is the primary purpose of mass child immunization programs? What medical procedure involves analyzing fetal cells and dissolved substances in amniotic fluid and is used for genetic disorder testing? Which institution in India developed the oral contraceptive Saheli for females? What does a decreased maternal and infant mortality rate indicate? Which of the following is an indicator of improved reproductive health in society? What does the development of new contraceptive methods and improvements in existing ones signify? Which institution plays a significant role in encouraging and supporting research on reproduction-related areas? What was a probable reason for the explosive population growth in the last century? What was the population growth rate in India, as per the 2011 census report? What is one of the most important steps taken to control population growth? What is a key characteristic of an ideal contraceptive method? Which category of contraceptive methods includes oral contraceptives and injectables? What is the key principle behind natural contraceptive methods? In which method do couples avoid coitus during the fertile period to prevent conception? What is the primary purpose of the withdrawal or coitus interruptus method? Which barrier method is made of thin rubber latex sheet and is used to cover the penis in males or the vagina and cervix in females? What is a notable additional benefit of using condoms besides contraception? How are intrauterine devices, IUDs, typically inserted? What is one of the functions of copper-releasing IUDs like copper T and copper 7? How do hormone-releasing IUDs work as contraceptives? Who is the ideal candidate for using IUDs as contraceptives? What is one of the advantages of using IUDs as a contraceptive method? What is the common term used for contraceptives that are taken orally in the form of tablets? How often are contraceptive pills taken during a menstrual cycle? How do contraceptive pills primarily prevent conception? What is the term for the contraceptive method that involves the removal or tying up of a small part of the vas deferens in males? Why is it essential to consult qualified medical professionals when selecting a contraceptive method? Which contraceptive method can be used as an emergency contraceptive within 72 hours of coitus to prevent possible pregnancy? What is the term for the intentional or voluntary termination of pregnancy before full term? Approximately how many MTPs are performed worldwide in a year, accounting for 1/5th of the total number of conceived pregnancies? Why is the legalization of MTP debated in many countries? In which trimester of pregnancy are MTPs considered relatively safe? What is a dangerous trend associated with MTPs and amniocentesis mentioned in the text? What is the collective term for infections or diseases transmitted through sexual intercourse? What is the most dangerous STI? How can some STIs like hepatitis B and HIV be transmitted, besides sexual intercourse? What are some complications that can result from untreated STIs, as mentioned in the text? What age group is reported to have a high incidence of STIs? What is one of the key principles for preventing STIs? What is another preventive measure mentioned in the text for avoiding STIs during coitus? What is the term for the inability of a couple to produce children despite unprotected sexual cohabitation? In assisted reproductive technologies, ART, what does IVF stand for? What is the primary goal of in vitro fertilization, IVF? What does IUT stand for in the context of ART? Which ART method involves the direct injection of a sperm into an egg in the laboratory? In which situation can artificial insemination, AI, be used to correct infertility? Why are assisted reproductive technologies, ART, not widely accessible to everyone? What is one of the alternative methods mentioned in the text for couples looking for parenthood besides ART?